Hi, my name is Tori, and I am going to go over how to administer food and fluid and medications through Crystal's nasogastric tube. Crystal has a tube that goes into her nose and into her stomach and somewhere around here. I don't know if you can appreciate it on her cute little face, but she has a little mark that's right at her nose. It's been made with a Sharpie tip pen, and we just want to make sure that that stays at her nose, at the level of her nose. If for some reason you've noticed it move, then we don't want you to feed through the tube. Crystal's tube has two pieces attached to it to make it easier for us to administer medications and food through here. There is a white piece and then an injection port that's on it. You can either take off the injection port or you can leave it on to feed her. It's just for simplicity's sake, we would make the recommendation to leave the blue port on. Before any tube feeding or any administration of medication, you want to take an empty syringe, attach it to her tube. You're just going to use a twisting motion, and you want to do what's called an aspiration. You want to pull back on the syringe and make sure that you're not getting any air back. You might get a little bit of fluid back, and that's okay. Like there's in here like a few drops of fluid, and that's fine. If I try to pull back harder, I get resistance, and that's what we're looking for. We're looking for what's called negative pressure in this system. So you can see as soon as I let go of my fingers, it kind of snaps right back in, and that is what we're also looking for when we begin a tube feeding. If you were to start her feeding and you just get back all air, or if you're just to pull it back, you get all air, we would make the recommendation for you to not feed through the tube, okay? Also, if you were to get back a large amount of fluid, that would be residuals that are left in her stomach, then we would make the recommendation to not feed at that time as well. This will be all in your notes. We will tell you how much minimum that can be left in her stomach in order for you to be able to do the next feeding. Okay, so at this point I'm going to disconnect this from her, the syringe from the tube, and I use a twisting motion to take it off. I'm going to instill a little bit of water just to make sure that the line is what's called patent, that it's nice and open and clear of any sort of accretions from previous feedings. And when I push it in, I feel that it's nice and easy to go. So at this point, I'm going to start my feeding. I'm going to take this off, and I'm going to attach her food. I should also note that if at any time you instill water into her tube and you hear her cough, do not feed through the tube. Call the vet. So when you're doing a feeding, especially when we're bringing her up to her full caloric rate, which at this point we still haven't done, we want to do this nice and slowly. So you want to give yourself anywhere from 20 to 30 minutes to perform this feeding. And you want to go nice and slow, and again, make sure there's no coughing. You want to watch her for any sort of signs that she might be nauseated. If you notice all of a sudden that Crystal is getting up and moving around a lot, or she's licking her lips, or she should start to drool, or she should start making gagging noises. I don't know if Crystal's the type of cat that vocalizes before she vomits, but if she does any of those things, then you want to stop the feeding or slow it down. Okay? You may want to first stop the feeding, maybe give her a few minutes, then start again, and then slow it down. Okay? And again, there's just like with the water that went through the tube, this flows nice and easy. It's a liquid diet. And it's just about the consistency of a very thin milkshake. At this point, I'm going to stop this video and we'll go over what we should do at the end of the feeding.